What are the common problems? As we have said, if there could be air leak, because it all depends on the seal at the perilaryngeal space. Poor ventilation or gastric insufflation, because just 0.5 centimeters or less than 0.5 centimeter behind the larynx is the esophagus, right? If there is some air which is leaking into the esophagus, this leads to gastric insufflation and risk of aspiration. And malposition, anytime when you're putting in the LMA and you move the neck or head or the patient, mobilize the patient from one place to other, there is increased risk of malposition, which will again lead to weak or inadequate ventilation, which would lead to desaturation of the patient. So how do you troubleshoot all this? So first you reposition the head, you check that the head is not in a different position, or even then if it is not improving the saturation or the ventilation is not being delivered adequately, you reinsert the device. You try to remove the device and reinsert the device, readjust its position. You change the size, upsize or downsize the supraglottic airway device. Else, if all these three also fail, then you convert it to a endotracheal intubation, like a definitive airway or a surgical airway.